12.
Good afternoon. Today is October the 8th. This is a special Board of Supervisors meeting. Madam Clerk, would you do a roll call, please?
Supervisor Johnson?
Here.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
Supervisor Watson?
I am present today, thank you.
Supervisor Angus? Here. Chairman Bishop?
I'm here.
And let me see. We're having some problems here.
Okay, thank you.
We're not hearing them.
Supervisor Johnson, are you on the line?
They can hear me. We can't hear them.
I'm here. Can you hear me?
Give me just.
Hello.
Okay.
Hello. I hear you, Buster. Thank you, Ron. I can hear them, and I heard you when you went in, but...
Apparently they can hear each other, we can't hear.
Okay.
Supervisor Johnson?
Here.
Supervisor Gould?
Here.
We are all present and accounted for.
Okay, thank you. We've got everyone on the line now, so we can begin the meeting. The first item be a discussion of possible action, Ray, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19 updates and taking any necessary actions based upon the updates. So we have Denise Burley, our Public Health Director, at the podium, and I'll turn this item over to you, Denise.
Madam Chair, members of the board, we have had 3,959 cases to date in Mojave County. 3,572 of those individuals have recovered, 217 deaths, and we've had 672 individuals, patients, cases that have been hospitalized at some point during their illness, which equates to about 17% of those that were infected. Our average age of cases is 47.7 years of age. Average age of deaths is 75.8. The number of cases over the last 3 weeks has remained relatively consistent, averaging about 61 cases per week. That's gone up and down a little bit, but really the average has been about 61 cases. How that translates in the benchmarks, and I don't know if you had an opportunity to look at those benchmarks this morning when they were updated at 9 o'clock. We continue to be in the moderate range, and what we're seeing is a slight increase in those cases per 1,000. Our lowest to date has been 18. The following week we were at, I believe it's 24, and then the last week reported in the benchmark category. So that's not like last week, of course. But going back 2 weeks was 34. Our percent positivity rate at its lowest within the benchmarks was 1.2. It's gone up in the last 2 weeks of the benchmark reporting, 2.7 and 3.5. So it's still moderate, very mild increases there. And then same with COVID-like illness. The stats, our lowest was 1.2%, and that has since gone up to 1.8%. But based on conversations with the hospitals, we are not seeing a huge increase in ED visits and so on within their facilities. So that's a good sign. Any questions about the numbers or the benchmark report?
Any questions?
Okay. All right. Just wanted to give you an update. You've probably seen out in the news the CDC update on airborne transmission. And there is now evidence that under certain conditions, people with COVID-19 seem to have infected others who were more than 6 feet away. These transmissions occurred within enclosed spaces that had inadequate ventilation. So small space, lack of ventilation and air movement through the system. Sometimes the infected person was breathing heavily. It may have been based on an activity that they were performing at that time. Under these circumstances, the scientists believe that the amount of infectious smaller droplet and particles produced by the people with the illness became concentrated enough to spread the virus to other people. These people who were infected were in the same space during the same time or shortly after the person with COVID had left. The important message there continues to be these are rare cases. These are not kind of the norm, if you will. The norm is still respiratory droplets. And the same protective behaviors work to prevent the spread. Washing hands, wearing face coverings, and social distancing to the degree that you can, the 6 feet. So those things still remain the same. Any questions on that?
Does anyone have any questions?
Okay.
I hear none.
All right. Wanted you to be aware that we are in the final 2 days, as I understand it, of the KRMC antibody research study. They are completing this research study and doing free testing for antibodies and screening for COVID. This is located at their Wallapai Surbat conference room. It's towards the back door, or back entrance of the Wellness Center. There's no appointment needed for this. The hours are 2 p.m. to 8 p.m. today and tomorrow, and that will be tomorrow night is the final night of this testing. So wanted everybody to be aware of that who would like to take advantage of that. Any questions there? If not, I'd like to bring up Lynn Valentine, and she'll be doing a short presentation on what we know today on the vaccines and where we are in terms of our planning efforts. So.
Okay, thank you.
Good afternoon. So at this point, you probably have already heard that there's several vaccines that are in the process of being manufactured. At this time, we don't know when a vaccine will be ready, if one becomes available at all. But there are several in phase 3, which is the final phase of the vaccine production. When it is approved by the FDA for use under the emergency use authorization, initially there's going to be just a limited supply of vaccine available. And who it will be provided to will be, it'll be focused on those individuals who are at higher risk, such as healthcare personnel, emergency responders. And then as more vaccine comes available, then other priority groups will be focused on, such as those with severe illness and at risk of more severe illness, I should say, those in long-term care settings. And then as more vaccine comes available, then it'll be open to more population of the population, with eventually the end goal being that there's enough vaccine for every person in the United States who wants to get the vaccine can get it. Right now, where we are in the state of Arizona, what the CDC has recommended all the jurisdictions do is basically get our providers ready to be able to administer that vaccine. And that is done through enrolling in this online provider onboarding survey, which is they go online and they provide all this information about their practice, their facility, and it basically explains to them what the requirements are for having the vaccine, because there's some very stringent requirements in order to receive the vaccine and to be able to administer it. So they have to ensure that they can properly handle it and they can store it properly, that they agree to report the administered doses. There's just very specific criteria that they have to agree to. So it's a little bit of a process. So the state has encouraged us to get our providers, encourage them to get on this onboarding provider tool and complete that survey, which is pretty lengthy, pretty involved. So we've been pushing out that messaging to our local providers. Hey, get on this online onboarding survey, and if you're interested in providing the vaccine to your patients. So we've been pushing out that messaging through emails, and we did a blast fax to get them on board. Right now, about 400 Arizona providers have signed up to be a vaccine provider. Just got word this morning that there are 16 providers or facilities within Mojave County who have started that process. Right now, we are just preparing as best as we can. I mean, we have limited knowledge on when and if a vaccine will come available, but we're working closely with the state. They have weekly meetings with a vaccine task force that we participate in, so we get the most current information and updates. They have also had one virtual tabletop training that we participated in last week, and they have another one coming up later this month. We are trying to share our information and working with our provider partners to keep them updated. And like I said, to encourage them to do the online survey so that they can become providers of the vaccine if they so choose. And we just continue to plan for any future vaccine clinics, whether that's on-site, off-site, and partnering with our provider partners to be able to have clinics when the vaccine comes available. So right now, it's just in process. We've got limited information, but we're trying to prepare as best as we can, I think, as a nation. And that's where we are currently. Are there any questions?
Any questions? Supervisor Angus.
It's not really about the vaccine, but while you were speaking, it reminded me that President Trump spoke about some medication that when you had it, he was taking. I know he talked about remdesivir, which I know we have here, but there was another one that he said is like the miracle cure, and he's letting people, hospitals have it for free. Do we know anything about that one?
I'm not sure I thought it was a steroid, which is a pretty common one, but I don't know if there's another specific.
No, it wasn't the steroid, but if you can look into that.
Okay.
Okay.
Sure.
Any other questions, comments? Okay. Thank you very much.
As we learn more, we'll certainly try to provide more information as we go along. And I didn't have any other additional information, but wanted to make myself available for questions.
Okay, does anyone have any questions? Supervisor Watson.
After you.
No, go ahead.
Thank you, Ms. Burley. A couple questions I have. The flu season, I think I saw something here lately that it started October, November, December. Is that the time frame for the flu season?
I believe so. The flu season.
Usually October through spring, like April.
October through spring, through April.
October through, all the way through April.
Correct.
Okay. Now, generally there's complications with pneumonia in older patients after they've had the flu or during the contact of flu. Do you have any idea of what the percentage of that is, of people that come down with pneumonia after they've had flu? Or what I'm trying to figure out, is there a comparison with coronavirus and flu and pneumonia, which is deadly for many people over the age 65?
I don't have that information offhand, but we'll certainly look into getting you an answer.
Okay, thank you.
Yes, absolutely.
Kind of a broad question, I realize, but it does have many ramifications. So thank you.
Absolutely.
Supervisor Angus?
Thanks. Just for the record, is there any financial incentive to doctors for doing the vaccines, signing up to do the vaccines?
Not to my knowledge. Yes, I don't believe so. This is an optional.
And by the time it comes here, it will no longer be a study. The studies are being done now.
Well, I think there'll be continued study of all the vaccine options, honestly. I mean, I think the research is such that it should continue on. And as more and more people get vaccinated, you learn more about the vaccine, and the vaccines evolve over time as a result of that research.
I guess my question is, if people choose to get it, are they going to be followed up on? Will they?
I see.
Yeah.
Thank you. Thank you for that clarification. I don't know, honestly, if that will be the case, and I'm not sure who would follow up with them, if there will be some research studies around that to follow up and ask about their experience and their health.
Okay.
Okay, any other questions or comments?
I have a question, Madam Chair, or a couple.
Supervisor Johnson, go ahead.
Thank you. Director, I know with the numbers going down, we've cut back on our contract tracers. How many do we have on staff now?
If you wouldn't mind, Supervisor Angus, I'm going to ask, do you know the answer to that?
Supervisor Johnson.
Sorry, Supervisor Johnson. The number of, we have 8? Okay. We continue to have 8 investigators on staff to address cases right now.
Okay, so if there was a second wave, you would need to add more depending upon the severity of it?
That would be true, Supervisor Johnson. It all depends on the severity of a second wave and the number of cases, and having to adjust and scale up our operation there again.
All right. Did you receive any results back from the Friday testing event in Lake Havasu?
We have not yet received any results back, Supervisor Johnson, but I'll check on that and try to get that information when we do receive it.
Okay. There have been several articles published recently that the number of COVID deaths in the U.S. is higher than the last 5 flu seasons combined. The Arizona Republic did an article recently on 2020 excess deaths in Arizona, and it counts our excessive deaths so far in 2020 at 22%. The article went on to say that the accurate number of deaths from COVID, both at the state and national level, will not be realized until this pandemic is over, and that the number we have today could be drastically undercounted. And with that said, do you as a director feel that we should still consider COVID-19 a pandemic and an emergency in Mojave County?
Yes, Supervisor Johnson. It is still a pandemic, not just in our county, but in the state, in this country, and throughout the world. So it does fit that definition, and we continue to operate in that mode.
Those are the only questions I have, Madam Chair, Director.
Okay, Supervisor Gold, do you have anything?
No,
Not at this time, Madam Chairman.
Okay, so Denise, what I got out of this presentation was that until there's a safe and effective vaccine, we need to do our best to just try to slow the transmission of this virus. Is that correct?
That's correct. Yes. Yes, that's our best prevention mode for certain.
Okay. Any other comments? Okay. Thank you very much, Denise. We'll go now to our next agenda item. This will be a discussion of possible action reference rescinding the proclamation signed on March 18, 2020, declaring an emergency in the unincorporated areas of Mojave County to address COVID-19, and direct the county attorney's office to review and update the Mojave County ordinance that provides directions on enacting an emergency proclamation. So I've asked the county manager to have staff do some research, and I'm going to ask the county manager to kind of give an overview of what he's done.
Thank you, Madam Chair, board members. This item was a continuation, item number 71 from the last board meeting. The board directed staff to research and find out any relationship, if there is any relationship, between the emergency declaration and the COVID-19 CARES Act funding and any other impact of rescinding this emergency proclamation on that CARES Act or the grant funding in general. So we took this task and broke it down into 4 different assignments to ensure that we get all the information into your hands to make a decision. So our financial services department had one component, public health had the other, emergency and risk management was the third, as well as the county attorney's office. I also contacted the County Supervisor Association executive director to also get a broader perspective from him. Again, just so we can put all that information together and provide it to you. So some of those findings were included in the backup of the item that was sent your way. What I'd like to do, if it's okay with the chair and the board members, is to have each of those department heads step up. In the case where we have information provided to you, you had a chance to look it over. She could answer any questions you may have. I didn't think you wanted her to go through what you already have. And then at the end, I'll share with you what I heard from the CSA Executive Director, and we'll all be here to answer any question you may have for us.
Okay, proceed. Thank you.
Sonia, would you lead us with your part of the task?
Okay, I think it's we have a PowerPoint if you want me to read through the PowerPoint and take you all through it. The first one is the FEMA-DEMA. The amount that we have spent so far is the $1.1 million, and the $170,000 is what we have been able to bill, that's been eligible to bill. To date, we have received nothing back so far. The PHEP COVID-19, the grant amount was $384,000, and we have spent $175,000, and our remaining balance is $209,000. Arizona Cares is $9.1 million, and to date we have spent, what he's doing here, go back up, 7.6, and we have an outstanding balance of $1.5 million. Arizona Cares ACESF is for the county attorney's office. The grant amount was $38,000, and we have spent $34,000 with a remaining balance of $4,000. Arizona Cares for the probation department, their grant amount was $7,700. And to date, they have recorded nothing yet, and that was for PPE equipment. The Hopwa Cares, they had $18,000, and to date, we have nothing spent, and that was for housing for HIV/AIDS. And then, let's see, that one was the program. The admin account is $8,000. To date, nothing has been spent or recorded. The COVID-19 complaint referrals, $25,000. I know Denise said they haven't recorded anything yet, but they have spent some money on that one. The CESF program grant is for the sheriff, and they had a $35,000 grant, and to date, nothing has been spent or recorded. The HUD, they had just one, $145,000. To date, spent $7,000, remaining balance $138,000, and that's for vouchers. Mainstream Cares is $14,000, and they've spent $231,000 to date with a $14,000 remaining balance. Today, let's see. Let me go to my notes. On the amount that we have received so far, is $9.1 million. We have a remaining balance to be received of $1.5 million. Additional grants received. Is that right, Judy? Yeah, okay. Of the Arizona Cares. The additional grants, to date we've received $849,000, and we still have a remaining balance of $461,000.
Any questions for Sonia on any of these numbers, supervisors?
Yeah.
Supervisor Angus, go ahead.
Thank you for that, because it appears to me that we still have a lot of money left, right? I mean, the bottom line is we have money that we got through grants and CARES that we have even yet to use.
Yes, Supervisor Angus. As you can see from the dates, we included the dates just so you can see when they came in.
Sure.
And obviously, it's tied into payroll, so we incur and then we submit and get reimbursed back. But you're absolutely right; those are the numbers.
Because we asked you to do this because the question on the table was, if we took away the emergency proclamation, what would that do to our money? And my point all along was that we have money, the money that was given to us for COVID, and we used it appropriately, and we still have it left. The most important one was Arizona Cares, right? And I've had it on, I went actually to the state, and if I may, just read you what the lawyer said at the state. If the March 18th state of emergency declaration in Mojave County is lifted, monies already received by the county may continue to be spent in accordance with the requirements of the grant program. For example, Mojave County received $9.1 million from the state's share of coronavirus relief fund monies. Based on our reading of federal statute and guidelines, these dollars are not contingent upon local emergency declarations. As long as the monies are used in a manner consistent with law and Treasury guidance, the county will not need to return the funds, irrespective of the statutes or the county's emergency declaration. Because that was the most important question that was asked on Monday. Were we going to have to? So that's off the table. We will not have to return any of the money that we got so far.
Madam Chair, Supervisor Angus, that is consistent with what we heard. You will see that we reached out, both our Finance Services Director, Coral Lloyd, reached out to Matthew Hansen. Matthew is the statewide grant administrator for the governor. And in my discussion with Craig Sullivan, who also spoke to Matthew or Mr. Hansen, that is consistent. So there is no implication if the emergency proclamation is rescinded. There's no implication on current funding. I also attached 2 emails that we received from Mr. Hansen that came to Coral, that for your benefit as well. So looking at those two emails, there is a question about any future funding, and they noted $400 million still at the governor's level that is to be allocated, and there are additional grants that are out there to be pursued. Just again, as a reminder, we did, for the CARES Act, we said we would use it for public health and public safety from March 1st through December 31st. We requested 9.8 and received 9.1. So you're right, Supervisor. We have on papers and what we have to date, we have funding left yet, but if it does go until December 31st, we will be falling short, at least on the CARES Act funding, because the total would have been 9.8. If I may, though, just so you get a full picture, Denise reached out to the Department of Public Health to get their input. If you'd like to
Let's ask you a quick question, Mayor, Madam Chair.
Yes, and I'd like to clarify, just so I know, who was it that you spoke to? Was it Mr. Hansen?
I spoke to Regina Cobb, and she spoke to their lawyers there who sent that along. And I think I don't think there's any argument that Arizona CARES money will not have to be returned. It doesn't fall under, the state has a proclamation of emergency. It's almost redundant that we have it. The CARES money came from the federal government through the state because the state had this thing of an emergency, and then they put it out around. It really had nothing to do with our emergency. But my quick question is this. So the CARES...
Before you ask your question, could I get the name of the attorney just so I have it on record?
Lydia Chu.
Lydia Chu. Okay, thank you.
Okay,
go ahead.
Thank you. So the money that we got that was meant for and was used for salaries for the Sheriff's Department and public health, right? We used that for those salaries during that period of time. What happened to the money that we had budgeted? We paid all the salary. We didn't pay above the salaries. So we have $7 million for that time that was allotted towards those salaries. What happened to that money?
You're talking about the general fund money,
Yeah.
Supervisor?
I mean, it was like a replacement money. So to say that, we didn't use all of it, it's kind of misleading, I think, to say that we use that money for salaries, but we have money in our budget for salaries. So it's like a double dipping kind of thing.
So, Madam Chair, Supervisor Angus, I was making the point that for public safety and public health from March 1st to December 31st, it's 9.8 million. We requested that, we got 9.1. That's really all I'm saying on that front. So if indeed the emergency continues and we continue to be eligible to the end of December, the 9.1 million will not take us until the end of December. We'll run out sooner. Now, that's talking about the CARES money itself.
Right.
As far, please understand, I'm not saying that we're going to run out of money and we're going to have to send people home. My point is, on the general fund, those salaries that would otherwise have come from the general fund, I'm going to go on memory with this, because just at the last board meeting, we had Carl Lloyd, our financial service director, step up and share with us what that went to. 6 million of that went into the contingency,
Right.
And then $1 million of that was
so it was
removed.
kind of
and so on.
I don't even mean this rudely. It was kind of a shell game. We moved money around. We did. We moved that money that came from CARES and it went into the contingency fund, and that's fine. That's where it should have gone. But my point is, we're not lacking for money. So for keeping this emergency proclamation for the hopes in the future to get a few $100,000, I kind of think that that's a bad way for government to act. I think it's bad for the public. And that's what we were trying to talk about today when I asked you to come back with these things. I mean, it just confirmed. Yeah, they don't know a lot of things. It's interesting how little the state government knows. But again, have it on good authority from the appropriations chair that there's a very, very small chance that the state's going to be giving any more money to the county. So I just think to base all this on money is frankly disrespectful to the people. And
Madam Chair, Supervisor Angus, we are responding to a request from the board to look into it. So it's really to us, staff. It's our job to work with you and provide the information. Having said that, though, and being completely respectful and appreciate what you're saying and where you're coming from, there is another side to this, and it is not the money, and that is there is uncertainty still out there, Supervisor, and I don't know what will happen. People that are much closer to it and more informed about the public health aspect of it don't know either. I'm just trying to see the big picture and offer you, the board, the information to make a decision.
And I'm not, my comments, even though I'm looking at you, are for everyone. Let's get that on the record.
Sure.
And one final question to Mr. Esplin. If we were to rescind the emergency proclamation today, there's nothing stopping us from doing it again should we have this alleged second wave, any time in the future. I mean, right? Just because we get rid of it doesn't mean we can't do it again.
Correct.
Okay. Sure. That's all I have for now.
Okay. Manager Elters, do you?
I don't really have a whole lot more to add. What you're going to hear from Denise and Byron is consistent with what I shared with you, which is there is no direct connection between the rescinding of the emergency proclamation and the CARES Act money that the county has today. Probably the other, just couple of comments that I have. One is there are, to the best of my knowledge and according to Mr. Sullivan, who is interacting with all the counties, no other county has rescinded their emergency proclamation, and only one of them had an expiration date or a timeline, and that was Yavapai County, and they have extended it, and so it's still in effect today. The only other comment that I have is not related to money. It is related to the uncertainty ahead of us, and that is if we rescind the emergency declaration, what impact will that have on the mandate to wear face mask or to facial covers in county facilities? Then there would probably be, it would beg the question whether we would need it or not. If we do rescind that as well or remove it, then there would be a question related to the public in county facilities and our employees, and how we've been really fortunate. We had only limited number of county employees that contracted the virus. We think the board acting early on and mandating it in county building and providing all the plexiglass and making face masks and face shields available to those who do not have it helped a lot. But I'm not trying to change minds or influence decisions, supervisors. I really just trying to see the big picture, and I'll stop here because that's all I had.
Okay. Thank you, County Manager Elters. Did you have anyone else that needed to present?
I'm not sure if Mr. Esplin has more to add, so please take it from here.
Sure. What I'll just do, just providing factual information for all the board so that they can see it. I reviewed the proclamations for the counties. And as County Manager Elters indicated, he's correct. From what I can gather and from what I can see, all but one county issued an emergency proclamation. The one county was Cochise. We could not find an emergency proclamation for Cochise. Otherwise, all the other ones did. Most of them are pretty similar. The language is pretty similar. It's kind of, I think they all kind of use kind of the same theory. It's all based on 26-311. Obviously, there's some subtle nuances and differences between each one. Almost all of them are for indefinite periods or there's no expiration on them. Similar to ours. There's nothing in ours that's specified that this will end at a certain time. There's none of that. As County Manager Elters pointed out, Yavapai did have one that specifically says that it ends on this day, but they have subsequently extended it. I made contact with one of their attorneys, and their attorney indicated that it is still in effect in Yavapai County. There was also one in Pinal County where it said it would be reviewed or considered for repeal or review or considered for reconsideration every 30 days. I did not see anything to indicate that they have subsequently repealed it, but that was a clause in there. But otherwise, the remaining of them are for indefinite periods or there's no specificity in the resolution itself that they will end. Also, just in our quick research of things, I couldn't see anywhere where any of the counties had repealed any of their emergency proclamations. So that's all that I have for the board.
Okay.
Madam Chair?
Thank you. Go ahead.
Thank you. I had a question of Mr. Esplin. If this is repealed, what happens to the early voting? Because I know we had a lot of people who are in that difficult age range, health range. Will we still have those people be able to work?
I don't think it'll have an effect on the early voting. I don't think so. I don't think there's a direct connection between those two. No.
Well, we have mask mandated early voting, though. That's what I'm asking. You know, we have a lot of employees, temporary employees that are kind of came to us because we had the mask mandate. That's all I was asking.
Sure. No, and I think that's kind of, I'm sorry, Supervisor Johnson. I think that's what County Manager Elters was talking about in terms of the effect if this board then rolled back the provision that county employees and wear masks and in county buildings and stuff. I think that's where that goes to that.
Madam Chair?
Just a second. Supervisor Johnson, is that all you had?
Yes, at this time, that's all I have, Madam Chair. Thank you.
Okay. Supervisor Angus.
I make a motion that we rescind the proclamation signed on March 18th, 2020, declaring an emergency in the unincorporated areas of Maumee County to address COVID-19. Is
there any further discussion?
Second. I have discussion, Madam Chair.
Okay. Supervisor Johnson, go ahead.
Thank you, Madam Chair. If Supervisor Angus will amend her motion to have the county return all funds that we've received for COVID, I have no problem with it. But if we're going to be disingenuous and take the money and not give it back, that just seems a little one-sided to me. I mean, the federal government, with the President's approval, have extended their emergency order until, the end of January. That's all. If they want to make an amendment, I could support it.
Supervisor Angus, did you wish to amend your motion?
No.
Okay. Any further discussion?
Madam Chairman,
Supervisor Watson.
was there a second on the motion?
I think Supervisor Gold did second the motion.
Okay. I have several questions.
Okay. We're still under discussion, so go ahead.
Thank you. If the proclamation declaring the emergency is rescinded today, what requirement and what basis do we have for enforcing masks for protecting our employees.
Attorney Esplin, could you take that one?
I have concerns about it. I do. I mean, the message that we're sending to the public is that we do not believe that there's an emergency here in Mojave County, so I don't see what the justification is for continuing to have a mask requirement in the buildings. I can't justify to the public saying, well, I want you to continue to wear a mask, or we need to continue to wear a mask, when the board itself, the elected body for the board, has said that there's no longer an emergency in Mojave County. I'd have real concerns about that.
And that's my concern. My concern is for the employees of Mojave County and also the general public. But in order for Mojave County to remain a solid force in our community and doing our jobs, I believe it's incumbent upon us to make sure that we have a healthy workforce. So with that, those are my comments.
And Supervisor Watson, if I could also just add to that, I mean, the premise of what the board passed for that is that there is a health emergency, and what our public health director has repeatedly said over and over, that there still is a health emergency. So we're not just keeping that in place because we want to keep it in place. It's because there's a health emergency in place, and that's why. And if the board here determines that there's no longer a health emergency, then how can you justify keeping that mask mandate? So.
As well as the social distancing,
Correct.
Of course.
Thank you. And I have one more question, or possibly two. My understanding is that really the only requirement that Mojave County is asking for is that protection in county buildings for our county employees and that of the public. We're not requiring mask or social distancing in any other locations. Is that correct?
That's correct. That is.
So if a person were to make an argument that Mojave County is being overbearing, being too obtrusive of their rights or their lifestyles, the only thing that we're really asking is for the protection of our employees and those folks that are coming in to our county buildings. Is that correct?
Yeah, I think that's a pretty good summation of it. Yeah.
Thank you.
Madam Chair?
Supervisor Angus?
Why can't we, I mean, just like businesses, there's no mask mandate, but the businesses are left to themselves to decide. Why can't we still say this is, if that's what the will of the board is, why can't we say we still, you know, I think it's wrong, but if that's what's going to hold this up, we still need you to wear masks coming in. I just don't get the connection between the emergency. It's a decision made by the county.
No, in your exact, that's a valid point too. And the thing is that I got to tell you, in practicing law and handling law, I don't always know exactly where the judge is going to go or where the complaint's going to go or where the lawsuit's going to be filed. And so what I have to do is I have to gauge what level of risk is out there. And the response that I had to Supervisor Watson was, it raises my concern. It raises my concern because I can tell you just my own experience that you know, my understanding of the Americans with Disability Act 7 months ago is completely different than it is today. It really is. We never envisioned something like this. And so when you have claims from ADA, because that's really what it boils down to, is someone will come in and they'll say, hey, I can't wear a mask because of whatever kind of medical concern it is. And so we have to determine, okay, well, if we're in a state of emergency, this factor, if we have this, we do this, can this exception apply? And so that's what I'm talking about, is that if you lift the proclamation today, then it's kind of you know, kind of a house of cards a little bit to say, well, why do we continue to have the mask mandate? But you could say that, you could say, well, businesses do that too, but businesses are doing it in order to protect their employees from a public health emergency, right? There's a health emergency in effect, but here the board is saying, no, there's no longer an emergency. That's the message.
But there's the emergency in the state. There's
True.
still a state emergency.
Okay,
so if you're looking for something to hang your hat on, that is it.
Exactly. So, and that's something that is a legitimate position. If the board is taking away this proclamation simply because it's redundant, then that's a different issue. Absolutely. Then I understand that. But if the board is taking away this proclamation because you don't think that this is an emergency, there's no health risk out there, that's a different issue. So you have to determine, why are you taking this back? If it's simply for redundancy purposes because we don't need it because there's already one in the entire state, that's a different issue than we're going to take it away because we don't think this is an emergency.
Okay. I have just one more thing to say, Madam Chair, and then I promise I'll be quiet because I have the motion is on the table. We're not taking it away to say there is no health problem out there. We're taking it away so people can make up their minds themselves how they want to protect themselves and the people around them. That's what we're saying. Because we say it's a health emergency because we take it away, doesn't let go of any of the facts that people are reading on themselves. People, we don't get any different information than everybody else does, right? We don't anymore. In the beginning we did. We don't. So people are getting the same information, and I think they're smart enough to make up their own minds on how they want to conduct themselves out in public. That's all.
And one last thing, and I'm sorry, just to go back to Supervisor Watson, even though it raises my concern, I still think that the county could still enforce a mask requirement in buildings, but it does creates potential for liability and lawsuits. I don't know the extent to which would be, but I believe that we could still try to defend the position. I do. For the reasons that Supervisor Angus pointed out, we can still defend the position because there's a statewide emergency, and there is an emergency in effect. But again, back to what I said previously, it raises concerns. So,
Madam Chairman.
County Manager Elters has been waiting patiently to speak, so go ahead, Manager.
Just want to jump in and add a thought to the last couple of comments that were made. So we still have the state emergency declaration in place, which would mean we still have the three ranges, and for businesses, meaning restaurants that have bars and then gyms and so on. So to that end, there is still the substantial range, the moderate range, and the minimal range. And for restaurants, for example, as long as we're in the moderate range, they can only operate at a certain capacity, and that's with face covering and social distancing. So the county rescinding the emergency proclamation will not change that. At least that is my understanding, and I wanted to remind the board and Mr. Esplin of it. Thank you for allowing me to speak.
And County Manager Elters, you were going to mention something about the County Supervisors Association discussion that you had with Craig Sullivan. Did you cover that?
I did, Madam Chair. I
just wanted to make sure there wasn't anything.
Yes, there is nothing else from my discussion with Mr. Sullivan that I needed, that I omitted, and so I covered the basis with it.
Okay, thank you. Supervisor Gold.
Thank you, Madam Chairman. Folks, the state of emergency is not about masks. It's about the fact that the county is operating under a state of emergency, which empowers the chairman of the Board of Supervisors to make executive decisions on her own without the board's input. That's what a state of emergency is. This emergency does not require snap action, and anything that we do regarding the COVID emergency can be discussed at one of our 2 weekly meetings. To me, that's what operating under a state of emergency is. Thank you.
Supervisor Gold, that is correct, and I have not made any rash decisions on my own without bringing it to the board. So it's kind of I know
not a reflection on your leadership, ma'am.
Thank you. I'm glad that you pointed that out, and I appreciate it. Any other comments? Discussion? Okay, we have a motion on the floor. It has been seconded. Madam Clerk, can you do a roll call?
Supervisor Watson?
No.
Supervisor Angus?
Yes.
Supervisor Johnson?
No.
Supervisor Gould?
Yes.
Chairman Bishop?
No.
Motion does not carry.
Madam Chair,
Go ahead.
I'd like to make a motion to send the emergency process of the chairman for updating without effect to any current emergency declarations to staff for updating.
Okay, to be clear, your motion is to update the wording on the current emergency declaration without changing the current status. Is that correct?
The policy, the policy that was put in place, that we have some spelling errors according to the county attorney, and then obviously the secession order.
Okay.
Madam Chair, Supervisor Johnson, are you referring to the old resolution?
Yes, ma'am.
I'll second the motion. Yeah.
Okay, we have a motion on the floor. It has been seconded. Any further discussion? Okay, Madam Clerk, how about a roll call on this one also?
Supervisor Watson?
Yes.
Supervisor Angus?
Yes.
Supervisor Johnson?
Yes.
Supervisor Gould?
Aye.
Chairman Bishop?
Yes.
The motion to update the current resolution in place has carried.
Madam Chair,
Supervisor Johnson, go ahead.
I don't know if I need to do a reconsideration or go back to item number 1, be up to the attorney, but Monday is a holiday and we have our meeting scheduled for Monday. How are we going to address that?
It wouldn't need a reconsideration. We can just, it's up to the chair to go back to item 1, and we can go back to item 1 and discuss it.
Okay, let's go back to, well, are we finished with item number 2? Okay, we'll go back to...
I just wanted to talk about my chart.
We'll go back to item
That I
number
sent
1
out.
then. Supervisor Johnson?
Oh, that was Gould.
I'm sorry, people are talking over
Madam-
each other. I'm having difficulty understanding, so. Supervisor
I had
Gould,
the clerk distribute a chart that showed the differences between Arizona and Sweden since that came up in our last meeting. And it shows that Sweden has a lower death rate than Arizona does. And Sweden did not lock down and destroy their economy. But it's just for your reference.
okay. You're welcome. Okay, going back to item number 1, Supervisor Johnson.
Thank you, Madam Chair. As Monday is a holiday, I would motion to move the regularly scheduled Monday meeting to Tuesday at the same time.
Second the motion.
Second.
Okay, we have a motion. It's been seconded. All those in favor say aye.
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 Any opposed? Motion passes. Okay, going on to item number 3, discussion of possible action. Ray, appoint poll site election boards, all special election board members and deputy elections personnel for the 2020 general election, and allow the election director to fill all positions through election day. Okay, I'll open this to discussion or a possible motion. Do we have a motion on item
Madam
number
Chairman.
3? Supervisor Gould.
I move that this item be adopted.
I'll second the motion.
Okay, we have a motion and a second. All those in favor say aye.
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 Any opposed? Motion passes. And this meeting is adjourned. Thank you.
Supervisor